Our healthcare communities mirror the diversity of the people they serve, fostering a compassionate, understanding environment where every voice is valued and heard.
The people of Queens County speak 135 different languages, and our team speak about half of those languages because they're truly reflective of the community that we serve.
It's very important for hospitals to recognize the cultural and language differences, especially in a very diverse community like downstate New York.
The best patient care comes from a relationship between provider and patient when there is a recognition of the value of community and the culture of a community and a connection to it.
Navigating the healthcare system can often be a complex journey for this community, especially with the obstacles posed by language and cultural differences.
It's so hard to be a patient today. Our system is so complicated. And so everything that we do together to make that easier is just a huge plus.
It's really important that we have these dedicated resources because we understand some of the challenges that some of our patients may have in navigating our services in the hospital.
And I think for those patients who are not as culturated, they encounter difficulty with language translation issues. They might fear discrimination sometimes. And they also, I find that sometimes don't really know how the U.S. healthcare system works.
Differences in culture and lack of trust in healthcare providers often drive Asian communities to delay seeking care.
They don't like to seek care because they're almost like a taboo, or they're shy in talking about their problems, especially medicine. Our main goal is to provide them with like a safe place to start opening up to us.
Every element within our healthcare network is deeply committed to consistently delivering the highest quality of care to our community.
So the role of the insurance company and at Health First, it's really to make sure that our members have what they need when they need it throughout their entire health journey.
So it all starts with quality. For example, we participate in Health First Quality Incentive Program, and Flushing has consistently ranked #1 in that quality incentive program.
The patient's thinking that this is someone that looks like me, that speaks my language, that understands my struggle, makes a very big difference to our community.
Because we are encountering these patients at their most vulnerable state, so their trust is fundamentally important, and establishing that trust through communication of their native language is critically important.
Trust to us is the most precious thing that we can build. It is being known in the community as genuinely interested in helping the community and really try to make their experience as seamless as possible.
I try to make the patients understand that I was talking about this because I care about them, that we're working together to help them. And I think that's very important.
A patient's health isn't just dictated by what medications you give them or what tests you do, but it's also about how you talk to them, how you relate to them, whether they have a feeling of being sort of respected as an individual.
Culturally, I was raised in Hong Kong. I share a lot of traditional Chinese values with them. I try to understand what's going on in their life, and so I can relate a lot of times. And it helps me build rapport with these patients.
Even that I didn't even need to tell them like what I really need, they can look at me and then they can find a problem already. Then I feel like very warm and welcoming when I come and then see the doctors in here.
Because the patient's journey in the healthcare system doesn't end with the hospital. It's very, very important for them to have continuous care.
So if we don't have the services, we will make an arrangement, make it happen. Not just like, hey, you need to do this, it's on your own. No. We are responsible to make it happen, get it done, have you back.
即係自己由唔開心變咗好開心咁樣，咁即係呢個即係好難對佢好深刻呢個印象。
And so creating those networks where the care is in the community, delivered in the community, and that there's easy access are all of those things that will prevent the unnecessary healthcare expenditures.
The unwavering commitment efforts of our healthcare community not only embody their dedication, but also reward them with a profound sense of accomplishment.
We have a lot of patients that are in cancer follow-up, so they may be a year, 5 years or more out from their cancer surgery. And this the look on their faces when you tell them your CT scan is clean. You can see on the look of the patients how nervous they are when they are waiting to hear that one little result. And then when you tell them everything looks okay, just the look of relief and happiness, and then they're off. Those little things are definite joys every day that we experience.
Every day we work with talented colleagues and provide the best medical care to the patients we care deeply about. That is a fulfilling day.
We bond over all the visits. We talk about, a good date to deliver. That's part of our culture. What's a lucky date? To accommodate up to reasonable requests from the patient to have a good outcome or an excellent outcome is what we strive for.
Since I'm pregnant with diabetes, we just give lots of information about what to do, what not to do. When I first go to take an insulin, it was quite nervous and it was kind of scary. But he's just constantly, it's okay, it's normal. It's just a basic, it's just starting. It's like those things inspire us a lot.
You know that old saying where home is where the family is? And being able to provide them with the care for them to be the first generation of Americans here is a very lifetime memory for all of us. Because America, we're all immigrants at one point. So it is amazing to see the beginning of that process for many families here.
Within this community, CAIPA redoubles its commitment, advancing further in promoting the well-being of the Asian community.
The goal of the foundation is to improve the quality of life of our Asian community and to bring health awareness amongst our Asian American community through education, through advocacy, and having accessibility for medical services.
When we started CAIPA, we said every year at the end, if there's surplus, 5% of the surplus will be donated by CAIPA to CAIPA Foundation. We'll use it to help the community.
For future projects, as technology improves, we wanted to see if we can get AI, artificial intelligence, as a tool to communicate with the elderly. Some of our older patients need mental stimulation in their daily lives, and using technology just to communicate with them will make a difference in their lives.
So the patient got benefit from foundations. They will stick to CAIPA, and CAIPA have more members, so that's how we contribute. The foundation do very well serving the communities and get the patient's problems solved.
So I'm asking you to give the CAIPA Foundation your support and enjoy your night.
We really respect and honor your dedication, and we are there for you to support you.
It's been great working with CAIPA for more than a decade now, especially since we share the same mission and vision as they do.
United Healthcare is honored to work with CAIPA as one of the longest-standing payer-provider networks supporting the Asian community.
And specifically tonight, I'd like to thank CAIPA for recognizing and really celebrating the culture of Asian Americans and really the contributions that they have not only to NYP, but really to society as a whole.
All of us feel very grateful for how they are guiding light in terms of the best care, the highest quality of care.
Congratulations. You've been leaders in the Asian community in New York City for as long as I can remember. Without CAIPA, we couldn't do what we do, and we're proud to be a trusted partner.
CAIPA's vast network of primary care physicians and specialists play a vital role in improving the lives of our patients. And we look forward to continuing to collaborate with CAIPA to ensure we are providing the highest quality, culturally relevant care to our patients.
And it's been an incredible privilege to partner with CAIPA and with the physicians who are so dedicated. CAIPA is a gift to this community. It earns it every day. And so we at Maimonides want to say, 谢谢 CAIPA.